I'm Harold Koenig. I'm at Duke University, and I've spent most of my life studying this connection between religion and health. And so I'm going to talk to you about this, what I would say is a natural connection of a person's health and well being and their involvement in a religious community. Briefly, historically, really the care of the sick originated from religious teachings. Many people aren't aware of that the whole notion of caring for people when they get sick um, began with religious orders. The first hospitals were built by the church. Many of the first physicians in the United States were ministers. Um, it really wasn't until the mid 20th century that you find a separation between religion and health occurring. Now, it had begun occurring back in the 1800s, with the French Revolution, but the real separation here in the United States didn't really begin until somewhere after World War II, as the National Institutes of Health began to support research that then all of medicine became evidence based. So religion and all the disciplines, all of the health disciplines, medicine, nursing, social work, are all trying to be scientific. Religion now has become kind of irrelevant, neurotic. Many feel that it conflicts with health care, creating these resistances to integration, at least from the healthcare side, that is trying to be more, quote, scientific. The result, of course, of that is that patients' spiritual needs are ignored or undervalued, and that's a problem that we're beginning to see now more and more. The relationship is improving, but it remains pretty controversial still. So, if there are these resistances from both sides that are preventing this collaboration, both from the religious side, the faith community side, and from the healthcare side, and that's what we're going to talk about, trying to overcome some of those. Well, one way to overcome some of those resistances from the medical or the healthcare side is scientific research. Scientific research is what healthcare professionals understand. They understand that everything they do is based on research studies showing that there is evidence that whatever they do has some benefit to the patient. So that's very clearly understood by medical professionals, by nursing, social work, all of the allied health professions, which are now science and evidence based. So let's look at some of that research that is connecting a person's religious faith with their health. Let's look at mental health. Well, religion is a very powerful coping behavior that I think is underestimated. Before we had any mental health care professionals, psychiatrists or psychologists or counselors, before any of that which has only been around for the past couple of hundred years at most, we had religion. So religion was the way people dealt with stress and trauma and loss, religious beliefs and religious practices, and support from the community, support from the clergy, etc. That's all there was. Or one's family. One's got support from one's family. So, but religion has evolved over the years to be very powerful in terms of conveying wisdom from past generations on how to deal with loss and stress, especially in situations where you've got uncertainty, fear, and loss of control. And, that's why Abraham Lincoln said, I've been driven many times upon my knees by the overwhelming conviction that I had nowhere else to go. And that's a real kind of that's a truth that many of us face, and after as when we deal with things in our lives. Okay, so let's take for example September 11th, since that is tomorrow is going to be the anniversary. During the week after September 11th, 90%, there was a survey of the U.S. population, and 90% of Americans turned to religion to help them to cope. It was literally the most common way of coping with the stress of September 11th, except for talking with others about it. Now, everybody talked, about it to somebody when it was happening, but in terms of a coping behavior, religion was the most common way that Americans coped. So now let's just try to see whether or not turning to religion to cope does any good. Does it benefit people? And that's what healthcare professionals want to know. They want to know if religion is good for your health. And so let's look at some of that research. Everything I'm going to summarize now, which I can only do briefly, is in the two books that are up here on the screen. The Handbook of Religion and Health, and this more recent book on religion and mental health. And I'll show you some of these books later on when we talk about resources. But this is where this research is coming from. It's a systematic review of research that's been published in the literature. So first of all, let's look at depression. So depression in hospitalized patients is lower among those who depend on their religious faith to cope. So this was a large study. This was in the VA, the Veterans Administration hospital. It included all men, and we found that those who relied on their religious faith to cope simply were less likely to be depressed. They were half as likely to experience depression compared to those who did not depend on their religion to cope. So this was eventually published in the American Journal of Psychiatry. Now here's another study. This was published in JAMA Psychiatry, and for some of you who are not aware of JAMA Psychiatry used to be called the Archives of General Psychiatry. Now this is the journal in which all of the biological aspects of psychiatry are presented. Research that looks at genetics and biology and medications, all of that is oftentimes published in this journal. It's probably the most prestigious and most influential psychiatry journal in the world. And there's not much debate about that. But in this journal, here was a study published by researchers at Columbia University in New York. They looked at the brains of people at high risk for depression. Now, all of these individuals were high risk, and we know that those at high risk for depression oftentimes have changes in the brain. There are parts of the brain that are smaller, that are actually reduced in size, particularly the cerebral cortex, which is what makes us absolutely unique among animals and why we are called human, because of our cerebral cortex. So among individuals who carry a genetic loading for depression because their parents had a serious depression and they kind of inherited that, there are changes in the brain. Now what these researchers did, they compared the structure of the brains of those who indicated that religion was very important in their life. They looked at that group. And then they looked at the group that said that religion was not very important in their life, or was only somewhat important. So here are the findings. Among all of these areas of the brain, there are two panels here. On the left-hand side is the brains of those for whom religion was not very important. And on the right-hand side are the brains of those for whom religion was very important. Now notice the red areas. The red areas are areas of significantly reduced cortical thickness. So you can see that among those for whom religion is very important, there's a lot less red on those brains, which means those brains are healthier and in fact are actually larger in many areas of the cerebral cortex compared to those for whom religion is not very important. So that's pretty powerful evidence that religion may make a difference in somebody's life, particularly if they suffer from depression. Now, what about suicide? Well, one of the most feared consequences of depression is suicide. And I know mental health care professionals, the last thing we want is for a patient to commit suicide. If patients are more religious, though, they are a lot less likely to attempt suicide or commit suicide. And there was a review. Our review showed that of 141 studies that have been done, 106 reported that religious people are less likely to commit suicide. So that's an important finding. Now here is a study, probably the best study to date. This was published in JAMA Psychiatry, again the top psychiatry journal, looking at the effects of religious attendance on suicide rate in a huge population. Nearly 90,000 women. These are all nurses, so they're very accurate in their report, of health issues. And this is the Harvard School of Public Health. And they found that the rate of suicide among women, and by the way, rates of suicide in the United States are increasing, particularly among women. There is something like, I think about a 50% increase in the suicide rate from 2001 to 2016 compared to prior to that among women. But what they found in this study is that the rate of suicide among those who attended church at least weekly was only 1/7 the rate of those who did not attend religious services at all. So that was pretty another impressive finding that seems to show that not only does depression help to reduce not only does religious involvement help to reduce depression, but it also appears to reduce the suicide rate. The same applies to alcohol abuse and dependence. Even more so, 90% of 278 studies that were done prior to the year 2010 show that religious people just don't use alcohol as much. They don't abuse alcohol. They don't become dependent on alcohol. Not as much as those who are not involved in religion. The same applies to illicit drug use. Less of that in 84%, 86% of the studies. And randomized trials show 95% of those show that religious interventions reduce the use of drugs and other substances that people become addicted to. Now, what's interesting about these studies for drug and alcohol use is that most of them are in young people, like in high school and college. So we're talking about almost the entire future life of the individual being affected by their religious involvement and its protection against drug and alcohol use. Now, that's all of the kind of the relationship between religion and negative mental health. Well, what about positive mental health? What about the positive aspects of being alive that we're all seeking, like to be happy, to have fulfilling lives, to lead meaningful lives? Well, those who are more religious just have more meaning and purpose. They have more hope and optimism. And I'm not a preacher here. I'm not, I'm just reporting what the scientific studies find in the literature. And anyone could reproduce these findings that are on this slide because they're done in a very systematic scientific way. So it's just a fact. It's just a fact that religious people have more meaning and purpose in life. They have greater hope. They're more optimistic. And all of those positive emotions have implications for recovery from health problems.